Right, so good day everyone. My name is Victor. I am a neurology applicant and I will be doing the Cheng Ching's comprehensive review in clinical neurology. We've done questions 1 to 63 and right now we're going to be doing questions 64 to 73, and this will be the end of chapter 1 of the Cheng Ching's comprehensive review in clinical neurology. So, this set of questions are actually very interesting questions in that they test the cranial nerves and where the foramen they pass through. So, before we take a look at these questions, I think it's best we do a brief talk about these foramens of the skull. So, let's begin. So, we're going to start with the very first cranial nerve, the olfactory nerve, and the olfactory nerve bundle actually passes through the cribriform plate foramina. So that's pretty easy. Olfactory nerve passes through the cribriform plate foramina. So the next is the optic nerve. The optic nerve has its own canal, which we call the optic canal, and it runs alongside with the ophthalmic artery through this canal. So that's for the optic nerve. Now the next one is a group of nerves. We have cranial nerve number 3, which is our oculomotor nerve. Cranial nerve number 4 is our trochlear nerve, and V1, that's the first division of the trigeminal nerve, and also cranial nerve number 6, which is the abducent nerve. Now all these nerves pass through the superior orbital fissure. Moving on, we have cranial nerve number still the trigeminal nerve, but this time V2, which is the maxillary division of the trigeminal nerve. This passes through the foramen rotundum, and then we have the V3, which is the mandibular division of the trigeminal nerve. This passes through the foramen ovale. And as a cute mnemonic to use to remember the sequence of the foramen that each trigeminal nerve bundle passes through. And some people I use SRO, some people use standing room only. So, and that stands for the superior orbital feature, the foramen rotundum, and the foramen ovale for V1, V2, and V3 respectively. Now, the middle meningeal artery passes through the foramen spinosum. So I think of the meninges, and I think of them covering the brain and the spine. So spinosum. So middle meningeal artery passes through the foramen spinosum, and the internal carotid artery actually passes through the carotid canal. So it has a canal called the carotid canal, and it actually in close relationship with the surface of the foramen lacerium. But it's important to note that it does not pass through the foramen lacerium. Now we have cranial nerve number 7, which is the facial nerve, and the vesiculocochlear nerve. I call them brothers in the sense that they pass through the same meatus or canal, the IEM, the internal acoustic meatus. Now, cranial nerve number 9, 10, and 11, that's the glossopharyngeal nerve, the vagus nerve, and the spinal accessory nerve, all pass through the jugular foramen. So the last and the least, which is our cranial nerve number 12, our hypoglossal nerve actually passes through the hypoglossal canal, so it has its own canal. And then the last foramen, which is the foramen magnum, is where the medulla oblongata, the vertebral arteries, and the meninges actually pass through. So back to our questions. So for question 64, the maxillary branch of the trigeminal nerve, that's V2, passes through which of the following is called foramina? So remember we said SRO, the S for the superior orbital feature, which carries V1. We said for V2, V2 passes through R, where is the foramen rotundum, and O for the foramen ovale, that's where we have V3 passing through. So our answer will be B, the foramen rotundum. So the next question is the internal carotid artery passes over which of the following is called foramina? Now remember we said the internal carotid artery actually has its own canal, the carotid canal, but it actually passes very close to and just above the foramen lacerium, where it does not go through the foramen lacerium. That would be option C, foramen lacerium. So 66, which of the following structures does not pass through the superior orbital feature? So remember, we said the following passes through the superior orbital feature: oculomotor nerve, cranial nerve number 3. We said the trochlear nerve, cranial nerve number 4. We said the V1, the ophthalmic division of the trigeminal nerve. Yeah. So let's look at these options. We have trochlear nerve. Trochlear nerve is right. We have trigeminal nerve, the first division, that's right. Oculomotor nerve, that's right. Trigeminal nerve, the third division, that is wrong. Abducens nerve. So remember that also the abducens nerve passes through the superior orbital feature. So the answer here is options D, which is trigeminal nerve, the third, or the mandibular division that does not pass through the superior orbital feature. So question 67, the oculomotor nerve passes through which of the following skull foramen? So we've already foramina. So we've already said that this will be what the superior orbital feature. That will be options E. So the next question is the ophthalmic division of the trigeminal nerve, that's V1, passes through which of the skull foramina? So again, this will be the superior orbital feature. That's option C. Question 69, which of the following structures passes through this foramen spinosum? So remember, when you think about the spine, you think about the meninges, the middle meningeal artery. So that's going to be option D, the middle meningeal artery. Question 70, which of the following structures passes through the foramen ovale? So remember, we said S, R, O. So for the O, that will be the V3 of the trigeminal nerve. That's the mandibular division trigeminal nerve. That will be options B. So question 71, the glossopharyngeal nerve passes through which of the following skull foramina? So we said it has a foramen called the jugular foramen, where cranial nerve number 9, that's the glossopharyngeal, number 10, that's the vagus, and number 11, that's the spinal accessory, passes through. So that is going to be our jugular foramen, options A. Now, the vagus nerve passes through the following skull foramina. We just said that. The jugular foramen, option C. And the last question is, which of the following structures passes through the internal acoustic meatus? So we said there are two of them, the facial nerve, nerve number 7, and the nerve number 8, which is vestibulocochlear nerve. So that will be options E, which is facial nerve. So that's all for now. We've done chapters 1, and this is really, really impressive and interesting because I never knew I'll be able to do this within a period of a month. I mean, it's less than a month, and then we're able to do chapter 1 by dealing with few questions every other day. So thank you so much for your time. Thank you so much for listening. If you are able to listen so far, we're going to be doing the next chapter very soon. I think we'll just move over to vascular neurology, although I am really itchy to do epilepsy, both adult and pediatric epilepsy. But let's do vascular neurology and let's see how it goes. So thank you for your time. See you in the next chapter.